Hello, I'm Dr. Tanvi Haldipurkar and I'm the Cataract and Refractive Surgeon at Laxmi Eye Hospital. There are few signs you can yourself pick up. One of them is if you, after the age of 45, 50, if you feel that your glasses are changing again and again, if your numbers are changing very frequently, maybe every 2 years, every 3 years, you're needing a change or a number is increasing in your glass powers, that is a sign that your cataracts may be progressing. The second is that you may notice a certain ornament or certain hanging in your room which may have had a certain color before and now you feel that the colors have become dull. That could be a sign that you are getting cataract. There are some things which can be picked up well by the ophthalmologist and there are some things which the machines can pick up. Today we have machines which can detect cataract which even we won't be able to see on a slit lamp. So what does that mean? Is that we are getting better and better to the newer technologies so that we can let you enjoy the crisp, good vision that you have been born with. Let's talk about how the surgery goes. A lot of patient feels that it's going to be painful, you won't be able to do anything for 1 month, it's going to stop you from your routine. Well, that's not true. Cataract surgery can be done by different technologies. We have the femtosecond cataract surgery now available. We have the Phacoemulsification, which is lets you do cataract through a very small incision, almost a 2 or a 2.2 millimeter incision, and we go inside, get the cataract out, and what we put instead inside the eye is an intraocular lens. Now why this is required is because without it, you won't be able to see. Your eye will need glasses as thick as a soda bottle. So when we do put a lens inside the eye, what you can see is almost things without glasses. Somebody who is wearing -12, -9 powered glass can finally now enjoy vision without glasses. So there are different types of lenses catering for different outcomes. There is no best lens that we can say. A lot of patients do ask us saying, best lens kaun sa hai? Well, I don't think there is an answer to that because it is the best match for your eye. Another myth about cataract surgery a lot of patients have, or I would say a misunderstanding, is that cataract can be treated with drops. And I fear that this myth has been propagated by a lot of companies who come up and say that here's a drop and we'll melt your cataract. Like I have mentioned before, cataract is a natural aging process. Our lens, which is clear, has protein in it, and that protein denatures over time, and which is why it becomes opaque. Until now, there hasn't been a drop made that can reduce or change that denaturation. So today, the treatment for cataract is always only surgery. We really cannot treat it with drops. Another question a lot of patients ask us is when should we operate? So there is in India a lot of seasonal change, and patients also have this misconception that surgery is better only in the winter seasons and not so much in the rain. And I think there was a reason for this kind of thinking, and let's make it clear that surgery, if done under proper aseptic conditions, any time of the year, any time of the season, it's all right. Cataract can happen at any age. It can happen to anybody, but it's not a scary problem because we are here to help you. All you need to do is get an annual checkup done with a skilled ophthalmologist who has all the equipment, who can diagnose your cataract and who can best match the correct lens with you. Thank you.